Member. Members, today I received within the prescribed time a letter from the Leader of the Opposition in the following terms. Dear Speaker, matter of public interest. I give notice that I will move as a matter of public interest that this House calls on the Premier to provide an ironclad guarantee that the state border will be fully open to interstate and overseas visitors from 3rd of March 2022, subject to travellers complying with appropriate state and federal government entry approvals and health controls. Yours sincerely, Hon Mia Davies. The matter appears to me to be in order, and if there are at least 5 members who will stand in support of this matter being discussed, and there are, the matter can proceed. The Leader of the Opposition.
Thank you, Deputy Speaker. I move that this House calls on the Premier to provide an ironclad guarantee that the state border will be fully open to interstate and overseas visitors from the 3rd of March 2022, subject to travellers complying with appropriate state and federal government entry approvals and health controls. Before we talk about this, and I would think that it's a motion that the government can easily agree to, Deputy Speaker, easily agree to. I just want to deal with some of the accusations that the Premier made during question time, particularly in relation to those about the National Party and Liberal Party courting the anti-vaccination cohort in our state. That could not be further from the truth, and I absolutely, without question, will put on record today that neither do we seek the support of the anti-mandate, anti-vaccination group that exists in Western Australia or across the nation, but that we have been very supportive of what the government has done to drive our vaccination rates up, including promoting vaccination clinics, encouraging people to go out and get vaccinated, and doing everything we can in our communities to ensure that people are taking responsibility for their health and their family and community's health. So the fact that the Premier thinks it's okay to stand there and say that we are asking reasonable questions based on the fact that you will not release information, that you keep that close to your chest, that nobody has any idea about what you're using to make decisions about the lives and livelihoods of this state, it's entirely reasonable that we ask those questions, entirely. So those documents that were tabled today at 2:30 p.m, uploaded onto the website at 2:30. If you were a cynical person, given that I know the Premier did a press conference earlier in the day and ducked and weaved to try and avoid answering whether or not that information, the Omicron modelling and the related documentation would be released today or tomorrow, was up at 2:30 p.m. after the start of question time, and then there was an email included in that information about, which is very specific, the time on it, Tuesday, date and time, Tuesday 22nd of the 2nd 2022, at 10:45 a.m. from Andrew Robertson, so the Chief Health Officer, to the Premier. Very specific about the announcement that was made on Friday, specifically talking about the removal of the restrictions for bottle shop proof of vaccination, specifically. And also talks about, I would also add, some of the questions that have been raised by the opposition and media over the weekend around the requirement for ongoing mandates and restrictions in pubs, bars and restaurants. Now, there'll be some more work to be done in relation to that particular piece of information that's been uploaded, but I absolutely reject what the Premier said during question time, that we are courting the anti-vaccination lobby. That is could not be further from the truth. What we've tried to do is support the government where there are reasonable restrictions put in place, where there is health advice to support that, and we've asked questions about where the modelling, the data, the information that the Premier is using to try and make those decisions, so that we can do our job as the opposition. So that's why last year we started asking the question, when would we see a decision being made about the border reopening? So this started last year, and the Premier made the decision that we were going to open on February the 5th, told the community that was what was going to happen, and we started working towards preparing our health system, getting vaccinations, businesses started to plan. Then on the 20th of January, we saw the Premier make a decision that that would be deferred, based on the fact that the Chief Health Officer had said we needed to increase the third vaccination rates and give more opportunity for children to be vaccinated, and that we were watching the eastern states to see what their levels of infections were. Now, that's fine. That decision was made on the 20th of January, and the decision to defer was announced, but then there was a void of information as to what percentage we were seeking to reach in relation to vaccination rates for third boosters, what percentage or trigger we were hoping to achieve with children vaccination rates, and what was the magical rate in the eastern states that would allow us to put all those together and come up with a new date. And that was asked again and again and again. And the Premier and the Health Minister again and again and again refused to provide information or advice, so we were left in limbo. And that's essentially where we have been until Friday last week, after the Premier and the Health Minister refused to answer question after question after question in the Parliament relating to those very matters, announcing it on Friday that we would finally have a date to work towards for March the 3rd. And so we come to the House today, to say that that must be an ironclad guarantee, that the Premier must give certainty to the community, families, businesses that are working towards March the 3rd, so that we don't have another period of limbo. We don't have the challenges that we've faced over the last weeks, while the Premier and his government have failed to provide any information or indication of the data, the science, the modelling that they are using to make decisions that impacted our lives and livelihoods. So despite the claims from government, and I did go through this last week, the opposition has supported many of the measures that were put in place to manage COVID-19. We passed legislation at the height of the pandemic when there was serious panic in this community. We encouraged our constituents to get vaccinated. We encouraged them to get vaccinated again. We encouraged them to go out and get their third booster. We've supported the mandates when there has been health advice to accompany those mandates. And we did that along with the community because there was a pact, a level of trust between the government that had been built up over 2 years, that if we all did that, then we would be given a date where we could start to move or transition to living with COVID and reopen our borders. And we, along with the community, depended on the Premier adhering to the health advice, and we expected honesty and transparency when it came to those decisions. And none of them after the decision on January the 20th were transparent. None of them. There was simply a void of information. So we don't deserve the hyperbole. We don't deserve the spin. And when I say we, I don't just mean the opposition. We've got thick skin. That's our job. I mean the people of Western Australia. Because we actually deserve facts. We don't deserve that spin. And I tell you, that performance on 20th of January, primetime TV, that was the spin machine in full flight. And we see it again today in question time. The Premier can't get through a question time without making it all about him. And so, you know, it's a bitter pill. It's a bitter pill for those in the community that have been working hard to try and continue to keep people employed, to make plans for when our borders reopen, that on the 20th of January they were left in limbo. The date for reopening deferred, in its place a complete void, and no details in relation to any of the data that they were going to be relying on. And when the Health Minister was asked in relation to, well, would you consider using information or advice from somebody they'd already used previously, I think it was Professor George Mill is the gentleman's name that provided Delta modelling, was dismissed as nothing more than a mathematician. Good enough the first time round, but not good enough this time, it would appear. So the opposition pointed out that the Chief Health Officer's advice raised several questions when that advice was provided on the 20th of January, or before the 20th of January. And for the period between then and Friday last week, there was absolutely no answer on waning immunity, what would happen if the community was exposed to Omicron peaking at the same time as our flu season, what would happen if we had the border closed indefinitely in terms of trying to recruit health workforce. We know that our hospitals are under pressure. We know that that's a consideration this government has had to make because they wasted that time over the last 2 years In fact, probably prior to that, because there was such challenges in resourcing and staffing our hospitals well before the pandemic arrived here in Western Australia. The Premier failed to answer any of those questions put by the media before Parliament returned, and then last week when Parliament was back and the opposition had the opportunity to put them to him directly. It is seeky, it is secretive, and it does nothing to build trust in a community that has been let down by this Premier from that day. Now, we don't wash away the fact that they built, and the Premier built, an enormous amount of trust in the community for its management of the pandemic over the first 2 years. That is not what we're talking about. But this government since that date, since the 20th of January, has reverted to that spin, that secrecy, that hyperbole, and it's smacks of almost yes minister. It smacks of almost yes minister, because I think they spent all last week avoiding the questions about when the border would reopen, when the modelling would be provided, what the data was that they were going to be used, so that they could have their press conference on Friday and release all of that information. And the Health Minister actually talked about that health modelling in the press conference on Friday, but still didn't release the information. Gave us the Cliff's Notes of the Omicron modelling, but didn't actually provide the detail or the data. So it left another weekend where we were wondering whether or not the response from the government has been proportionate and reasonable in relation to the restrictions that have come in this Monday, and whether or not we're going to actually see those borders reopen on the 3rd of March. And that's the question. That's the question. Will the Premier, will the government support this motion and give the people of Western Australia that ironclad guarantee, so that those that are in the tourism industry, our businesses, those in regional Western Australia, our families, can get on with planning to live with COVID? They've done the hard work. They've done the hard work. So that is what we're asking today. The date is essential. It is a marker for the government to rebuild its relationship with the state, the nation and the rest of the world. And I have to say that there's been more than enough commentary in national and state media to go to the point that there has been a rift between this government and the business, the international sector. The member for Roe and Shadow Minister for Education has highlighted the challenges we face from a reputational point of view. So there's no shortage of those, and whilst I will concede that it's not unusual for a Premier from Western Australia to be parochial about Western Australia, what we've seen over the last 2 years is a Premier that has deliberately antagonised other states and deliberately played on the fears of other. Deliberately. You've made an art form of alienating and provoking anyone outside the state over the last 2 years. And it will come back to bite us. It will come back to bite us. So that delay to opening on the February the 5th did damage our reputation. It did damage our reputation off the back of being locked away. It was the straw that broke the camel's back. And that's why the Premier cannot walk away from the 3rd of March.
Members.
It's why we need to see a concerted effort to re-engage with our interstate and international markets. It's why we need to see some of the surplus this government has amassed directed into campaigns to prove that we are open for business, that we will stay open for business. Our recruitment of health workers must be turbocharged, because we're going to need every single worker we can get our hands on. And given the eastern states' peak is passing and their workforce is likely to face less challenging environments in their hospitals, good luck trying to encourage them to come over here and deal with the peak in Western Australia when we've told everyone that we've been closed for business for 2 years. We've alienated and created challenges for this government, and they need to address it post-haste. Finally, the Premier should do away with the gimmick of staying in quarantine for 7 days when he returns from over east. If there's a rule for the rest of Western Australia, there's a rule for the Premier. I cannot understand why the Premier insists on quarantining for 7 days. It is a gimmick and it is grandstanding and it is not necessary. If it's necessary, then it would be necessary for everyone. This is why it's so confusing. We've had messages that chaos and confusion, flip-flopping, changing rules. The government needs to get on, give an ironclad guarantee for us to return to transitioning, living with COVID, opening our borders, and provide some of that certainty for the people of Western Australia. That is what they deserve. They've done the hard work. It's very simple, Premier. It will provide. Just vote for the motion and provide that ironclad guarantee that March the 3rd is the date that we will reopen.